Now coming back to this cardiac procedures here, we'll have to give importance to the valve procedures. Some of your relatives or your friends might have been affected by this, right? Where the problem is in the patient's valve. You must understand with regards to the ICD-10 coding of these valvular disorders where the patient might have a history of rheumatism or rheumatic fever. So there is an adage, rheumatism kicks the joint and licks the heart, which means as a consequence of rheumatic fever, it is a heart which is getting affected. That is why if you see in the ICD-10 code listing, you might find a rheumatic valvular disorders as a separate section. Okay, so whenever there is a history of rheumatic fever, you will have to take a code from the series of rheumatic affections, whether it is a rheumatic mitral valve disorder or insufficiency or a tricuspid regurgitation, things like that. So just bear in mind that there is a separate code when the patient has a history of a rheumatic fever. Coming to these valve procedures, you should be knowing what are the common procedures that are done in a valve. As you are aware, there are so many valves. They are the pulmonary valve, aortic valve, mitral valve and the tricuspid valve. We have 4 valves. Please go and read the anatomy for good understanding.